Hi, I'm Eileen, and this educational video is about causes of back pain when bending backward. Now, if you haven't seen any of the other videos, there is on causes of back pain when standing up from sitting, causes of back pain when bending forward and turning. So lots of different videos on this. So I'm not going to go over what I put in when standing up, because that may be the same issue you're having, but if you're having pain just from going from sitting to standing up, then those muscles are really struggling to lengthen and control you upon standing so that you don't fall backward. They don't want to get longer. They've lost their ability to lengthen under control, under tension, to eccentrically get longer, which is when a muscle gets longer under tension, right? So that's a pretty intense issue that you really want to take care of. But pain when bending backward, it may be the same problem, but it's not as bad. It hasn't progressed to the point where you can't stand up and straighten up when you're sitting. So if that's happening to you, please watch that other video. But if you're somebody who can sit for a little bit and get up and not have back pain, it only hurts when you bend backward, this video is for you. So when we bend backward, what happens, right? So if I do this and I bend backward, you can see I can bend backward pretty good. And I'm not overly flexible. I don't do yoga. I don't do stretching. I load my muscles eccentrically so I have good range of motion. In my 60s, I'm pretty mobile, right? But you want to be able to bend backward pretty good. Now, if you can't, what's going to happen is you're going to do this. You're going to bend your knees, and guess what? I'm not really bending backward here. I'm just kind of going down into a little bit of a squat as I lean back a little bit. That's a whole different story. Now, if you have pain when you bend backward, let's talk about some of the potential causes. Okay, one of the causes could be that the muscle, that deep psoas muscle, that is responsible for your hips extending, because bending backward, my hip has to be able to extend, right? So you might also notice that when you take a long walk or even a short walk, you get some back pain, because when you go to extend your hip, when you take a step, that may be pulling a little bit on your low back, because those muscles attach to the front of your thigh bone, your femur, up at the top where the hip area is, and then they come all the way up and attach to T12 through L4. So the majority of your lumbar spine, you've only got 5 vertebrae in the lumbar spine, and it attaches to 1 through 4, so most of it, and T12. So it can also impact what happens with your trunk if there's some limitations, okay? Because your trunk is the thoracic, between the neck and the low back. So it's important to understand that if those muscles have lost the ability or are impaired when it comes to function, when it comes to getting longer with control, which is what happens when you bend backward. So when I bend backward, those muscles have to control me, kind of like the reins on a horse, so that I don't fall back and smack my head open. And so they may struggle to get that long. They may have lost some strength or the ability to load as they get longer, okay? And I'll explain that a little bit better. So a lot of people know a bicep curl, right? It's a very basic exercise. You just pull that weight up. My bicep muscle is getting shorter as I bring the weight up, right? It's getting longer as I lower the weight, and if I lower the weight with control, it's eccentrically loading so that I don't drop the weight. It doesn't just swing down with no control. So that's eccentric control. We want that in all of our muscles, because believe it or not, your muscles are designed to subconsciously respond to motion that's been initiated. And there's some physics involved. A body in motion tends to stay in motion. For every action, there's an equal and opposite reaction. But as you initiate movement, now your muscles are controlling that movement as long as you keep moving. So when I walk, muscles are getting longer, controlling my motion, how my legs are moving, how my trunk is moving. they're not necessarily concentrically shortening when I walk. They are more often than not lengthening as I walk to control. And I won't get off into like, hamstrings control the knee and all that stuff, because I want to focus on what happens, causes a back pain when you bend backward. So I want you to know that those psoas muscles, you've got a right and a left, will control you as you bend backward, kind of like the reins on a horse. So I don't want to go too far, right? They're controlling you to keep you safe. If they've lost that ability, there's some things that we can do about it. Now, there are some other issues. If you're getting pain shooting down the leg, if you've got sciatic pain, you might get some real specific pain down here in the SI joints. That's potentially a different reason. We're talking about, general back pain up in here when you bend backward, right up in the lumbar spine area, okay? So, but you could get some SI pain as well. If that's yanking, it could make other things, because everything's connected to everything else. If my memory serves me, you got about 28 muscles that go into the pelvis that affect motion of the pelvis. But the whole body impacts what's happening in the whole body, especially from the ground up. I mean, if I taught you just what your heel bone has to do to trigger everything that happens above from the ground up, we'll do a video on that at some point. But for now, let's stick with bending backward. So what I'd like to do is teach you a couple of movements that might really help you to restore those muscles' ability to eccentrically load, right, and control bending backward so you don't experience pain. Because the lumbar spine is designed to bend forward and backward. When you look at those vertebrae, those 5 vertebrae, how they stack atop each other, they're really good. Movement is controlled by the shape of the bones and how they orient to each other. So the lumbar vertebrae are really good designed at bending forward and bending backwards. So if you have pain in either one of those motions, there's probably something else going on. And it's probably not your back. And I've kind of joked and said you can ignore the low back to fix the pain, because it's usually something going on in the thoracic spine above or something in the hips below. It's rarely the low back, unless you have a herniated disc or something like that. But there's even imaging that shows a lot of people have a herniated disc and they have no back pain, right? And there are people whose herniated discs resolve and get better, but their back pain worsens. So a lot of the times we kind of blame our symptoms on what shows up on imaging, but the imaging, what shows up, may have nothing to do with the pain. And that's why you really need to be informed so you don't end up having some procedure or some surgery that may or may not be what's causing your pain. Okay, it's very important to be informed. So here's what I want to show you on how to start getting those muscles to work better. It's very simple. I'm going to kind of progress. I'm going to show you more than one motions here so you can progress yourself from this video, all right? So first what we're going to do is we're going to see, can I do a toe tap backward and forward? And what that does is that kind of loads the front and the back of the hip, and it allows it to get longer and shorter and longer and shorter and control the motion. So if you need to hold on, I recommend you hold on. You don't want to, lose your balance. So I want to show you kind of a progression of 3 different motions that will help to restore the function in those muscles if that happens to be the cause of your back pain when you bend backward. We're going to start off with something very, very simple. It's like a toe tap. And what I want you to do is hold on in case you've got balance issues, but also if you have pain standing on one leg, then taking the stress off by holding the opposite hand of the leg you're standing on can sometimes inhibit that pain from happening, right? Pretty much eliminate it. And that's the goal. We don't want pain when we're doing this. This is not that no pain, no gain thing, because your body's only going to train in dysfunction. Your brain is going to say, oh, guess what? That hurts when we do that. So let me see what muscles I can pull in to use so that that doesn't hurt. And it's going to find the wrong pathways, the wrong muscles, the wrong timing of the muscles firing. And you're going to train in dysfunction, not restore authentic human function, which is the goal, okay? So that said, no pain with this, and you're going to progress as your body tolerates it with success, because then you're going to build on that success. So we're going to start with just some toe tapping. So what I'm going to do is I'm going to toe tap behind me, and I'm going to toe tap in front of me. Now, what does that do? When I toe tap behind me, because I'm actually leaning forward and I'm moving this leg behind me, I'm not just bending my knee, right? If I bend my knee, nothing's happening as far as loading the other hip. So what I want to do is I want to toe tap behind me as I lean forward a little bit. That's loading the back of this hip. And then when I toe tap in front of me, that's loading the front of this hip. And you can see I'm leaning back just a little bit when I toe tap forward, leaning forward just a little bit. This isn't coming way down here and way back here. Our goal is to just sort of get that muscle back to work, just kind of remind it, it's vacation's over, time to start doing your job. And so when I go backward, what I'm doing, loading the back of the hip, is the front of the hip is sort of relaxed. It's not really having to get longer under tension. It's not having to load because I'm loading the backside, right? Now, lots of other things are happening, and I won't get into all the complexities of that. But just know that if I'm loading the back of the hip by leaning forward, I'm kind of shortening and sort of allowing this muscle to say, you're not making me get longer. So we unload it first, and then we load it. But we load it just a little bit. We load it so that it can take it. It's okay with that. It's not unhappy with that, right? It's successful. You feel confident, and you feel competent doing that motion. All right, obviously we always do it on both sides, even if there's only a problem on one side. You want to get both legs, because when you walk, you're using both legs. When you stand, you're on both legs, okay? And so we want to make sure we're doing both sides. Then to progress that from there, after you've done that and it's feeling pretty good, we can just add an arm motion. Very, very simple. So as I'm going backward, my arm goes backward. As I'm going forward, my arm goes up and overhead. Now, obviously, if you've got a shoulder issue, this isn't going to work. But if you don't, this will really help you to add a little more work, because as I do this, it requires my anterior chain, or the front of my body, to load a little more, to lengthen a little more. So it's this progressive kind of inchworm thing toward getting those muscles to work properly again. And then the next step would be to actually take a step, okay? Because when I'm doing the toe tapping, I'm not really putting any weight on that foot that's tapping. Everything's here. If I take a step, it's going to be a little bit more involved. So if I take a step back, now that's loading more. And then if I take, sorry, let me get this out of the way. And then if I take a step forward, that's loading it even more. Now, it's important that as you come forward, your knee is straight, because if your knee is bent, guess what? This bends more, and it takes the need for it to load under length, under tension, from having to work as much. So I'm going to step back, and I'm going to step forward. And as I do that now, I've progressed, right? So that muscle doesn't mind getting longer. It gets shorter, and it gets ready to get longer. It loads, and it unloads. It loads, and it unloads. And so that's going to really help that muscle to restore. You can even progress a little further from there and add the arm motions, right? So as I step back, my arm goes back. As I step forward, my arm goes up and forward. So that's a nice progression to start getting that muscle to be happy about getting longer again and controlling your motion when you bend backward without eliciting pain. I hope this really helps you. If it does, please subscribe. You'll get notice of new videos. I've got so many more things that I would love to teach you that I plan on doing over the course of the next weeks or months or years. Lots and lots of things that I think if you know about them, it's going to really help you to know how to train your body for authentic human movement so you can move without pain and age without decline. All right, I'll see you next time.